Several people have asked me why I wanted to do this docu-series on health equity leaders and the health equity movement. And I think I was feeling like there was a gap in both the understanding of, what motivates leaders to take up this work, but also like this gap in the way we're training the next generation of scholar activists. It strikes me as curious that at the time in a scholar's development, when they are most primed to be translational, to like advance policy, to produce innovative scientific and engagement approaches to the work, that we encourage them to wait, to wait until you get tenure. Don't be an advocate, just be scientific, as opposed to encouraging them to leverage that fire in their belly to move little and, big needles on health equity problems. And, someone said to me recently, after giving a talk, that I love that what you do because you're almost evangelical, but you're data driven. And, I laughed about that, one, because I, grew up in a Kojic church and I do understand well the power of evangelism. But I also laughed because I thought, she missed an important point about that I am evangelical and I'm data driven. And I think that if we can inspire young scholar activists to be bold and courageous, both in their convictions, but also in the questions they ask of the data and in the ways that they go about doing the work, then we will produce a sea change in this field. And there is no time like now when that is needed the most.